everybody, this is Alchemist 2, and I'm back again with another book review. This is written by Dr. Rana Adwish, or Oddish, and it's called In Shock, My Journey from Death to Recovery and the Redemptive Power of Hope. And interestingly enough, I was talking to actually a coworker was opening up to me about how many miscarriages she had had. Now, I've never been through that because I've never been a mother, but I can't possibly fathom how devastating that would be, especially for a young mother, a healthy mother, especially like Rana. And she describes that gut-wrenching reality that she came to after going through HELLP, which a very small percentile of pregnant women suffer from. And she could have died, but her infant unfortunately didn't make it. And it tore her apart, literally. She couldn't handle it. And she was a doctor, and she was just in this situation that rendered her helpless. And it expresses the fact that doctors and patients sometimes they don't have the best bedside manner. Nurses usually do. Nurses know a little bit more about how to handle people. Doctors, not so much. DOs typically do, but my mom was a nurse. I know this from experience. I've seen it. I've been in enough hospitals to know what happens, and I'm not myself. I was going to go into the medical field, but I know a little bit about this, so I can vouch for it. I just know that there are certain people in the field that have absolutely no kind of repartee with patients, and there should be a bereavement program for mothers who lose their children, and I absolutely agree with that. There isn't anything like that right now, and it's so cold and unfeeling, and they're very sterile in the way that they rattle off facts like they were taught, and there's no real human element to it. And from what Rana says, that definitely needs to change. And when she went through her devastating experience, it shook, it literally, like it says, in shock, it shook her to her core. And it gave her an entirely new perspective of how patients sometimes are treated, and just as not in the room within earshot, they can still hear you even though they're unconscious, under anesthetic. And it's true that when you're under anesthetic, you can hear because the unconscious is a very unusual thing. But I thought this book was very enlightening and very revealing, and she didn't sugarcoat anything, which I appreciate. I'm glad that I'm actually not glad that she had to go through the experience that she did, but it taught her quite a bit, and there was a happy ending for her, and she did get the family that she finally wanted. Though it's very surprising to me that she had that issue so young in her life, and she should have been able to have a healthy child, but it didn't happen that way, I guess. And a lot of complications had occurred, and she suffered so many different kinds of shock, it wasn't even funny. And the doctors, the people in her medical team actually kind of teased her for that, and I thought, that's kind of gallows humor, you guys. Ha ha. But just to keep the levity going, and kind of dissuade her from having those dark thoughts. She mentions that her mind would go to her first child sometimes, and wonder, had she not actually survived, it would have been a bittersweet time for her daughter or son, just blowing out the birthday candles and then going to the graveyard and standing at the headstone and just, sorry you can't be here, Mom, but, you gave up your life so I could live. But it's like it says, it is sobering, but it's a very well written book. It's got all the lingo that you would expect from an MD. Uh, I love her explanation and all the medical terminology. Excuse me. It was what I expected from a book like this, and this trying to see when this was written. If I can, it doesn't really say. Yeah, it doesn't say. But from the very beginning, I like her introduction. I'm going to actually read a little bit from the book. Medicine can be a magical lens through which to view the human body. Focus its lights. Yeah, sure. Focus its light on an unsorted pile of symptoms, and it will converge them into a diagnosis. A swollen red strawberry tongue in a feverish child will lead the doctor to examine the heart and affirm a diagnosis of vasculitis. A man's burning stomach pain transforms into gastritis, which has both a cause and a cure, whereas his nonspecific pain had neither. Medicine does this by asking questions and listening not just to what is said, but what may be true. If empathy is the ability to take the perspective of another and feel with them, then at best the practice of medicine is a focused, scientific form of empathy. Truly caring for a patient necessitates traversing borders and inhabiting the view of another with the humility of a visitor who knows he or she can choose to look away. They each possess the power to heal. The first time I viewed the world through a medicine's transformative lens, I was 5 years old, listening as my mother offered a seemingly vague description to the pediatrician by phone. My brother was leaning forward in the crib, into his hands, drooling, and seemed to be gulping the air rather than breathing. The doctor had understood this to be epiglottis, an often fatal swelling of the airway. He instructed her with a calm but firm urgency to bring him immediately to the emergency room, where he would be waiting. That ability to translate symptoms into diagnoses and treatments, the power to save lives through knowledge and listening, struck me as the most beautiful job description I could imagine. And she goes on through how she learned the anatomy and physiology in the Latin and Greek and all the roots and all that. And the vantage point of her ICU bed. And I also like this part when she declares medicine can't heal in the vacuum, it requires connection, and she mentions that we require more of that as patients and doctors. To inhabit that vulnerable space and have no one around you to an open discussion is absolutely devastating. To desire to be seen, to be known, to share our experiences, and to feel heard. Amen. I know this all too well. To have our life events given in context and meaning redirected back to us in a way we can understand and integrate into our understanding of who we believe ourselves to be. This is more acute in times of sickness. Indeed it is. When organs and limbs function without fail, we can indulge our self-notions. We can indulge notions of self-reliance and agency. We believe ourselves to be the narrators of our own lives. When we are sick, we are humbled by our dependency on others. The loss of control, the uncertainty of ending. This change opens channels and hardwired not to tune into the monotonous routines and spaces of normal lives. Recognizing those open channels and fostering connection in the view of the knowledge is what heals. And she goes on, and it's really quite revealing, I think, and just so reassuring to understand that she knows she gets it now from having been in the ICU like she was, and having gone through that terrible experience of losing her first child. But it's a very tragic book, but it actually has, like I said, it's got a happy ending. But I recommend, if you're interested in the field of medicine like I am, then I would definitely recommend it. It's stupendously written. It's easy to follow, even though some of the lingo might be a little bit lofty at times. But I really don't have that much else to say about it other than it's just really a wonderful, very short book that is also very revelatory, and just how. So I know that there are times that we exalt people in these fields just because we feel like they've been given the training, the expertise, and the schooling to do such things, but not have that kind of human connection. It's more science, and the whole, like she said, is medicine is different. Medicine has that empathy. It has compassion. It has, well, it should. The Hippocratic Oath, it's first do no harm, and sometimes it's lost in translation. But I think nowadays, more often than not, especially in palliative care, which I've seen this head on and first foremost, and I never would be able to do it myself because I can't go through that again. It's too hard. But I do love to help people. But palliative care is just a wonderful line of work, and not for the faint of heart, and especially bereavement too. It goes into that, they go hand in glove. Coroners, they all have jobs that none of us would ever want to be paid for, especially funeral directors, but it's part of life. And it's not the end, as she says, it's not the end. To give somebody that sense of closure, that you have to be careful with religion and all that, but I myself, I do believe in an afterlife. I don't have proof of it, but I believe very wholeheartedly. I know that my mom and dad are looking down on me. They come, and like today I heard a little ditty on the radio, so I know that mom was just saying hi, like she does. But anyway, Dr. Oddish, she has written a book that's very profound and thought-provoking, and I'm hoping that people could pick it up and read it and get a little bit of more understanding, and not put doctors on such a high pedestal as they do. I mean, I was guilty of that myself, and I suffered from the exact opposite, having had been pharmacy tech in training, and everybody coming to me, oh, and asking me all these questions, and being, stop, cut it out, please. I can't take it anymore. But anyway, that's all I gotta say for now. So until next time, live long, prosper. Ciao, tutti.